Hi everyone, my name is Maxine and I am a fourth year pharmacy student, and today we're going to be discussing a career in pharmacy. This presentation today is geared more towards our college students, so if you are just beginning your undergrad or if you currently are in undergrad, you are in the right place. So I want to take just a moment, maybe pause this video and stop and think, what do you think of when you hear a pharmacist? So I don't know if you took a minute to pause or not, but maybe some of you guys think of your local Walgreens pharmacist or your local CVS pharmacist, which yes, is true. But I want to inform you guys today, which many of you may already know, that pharmacists play a role in many, many different areas that sometimes we don't think about. So what do pharmacists really do? We are the drug experts. You go to school for a number of years, you earn your degree to become a drug expert, and you really are that person that patients and healthcare providers will turn to and ask questions to pertaining patient's treatment, a drug regimen that may not be working for a patient, or if someone's experiencing side effects, pharmacists like, why is this happening, or what could we do to make sure that this doesn't happen? We are the drug experts. Another big role that pharmacists really have and comes into play is collaborating. And this may include working alongside doctors, nurses, different healthcare professionals to make sure that a patient is receiving the correct and proper treatment that is needed. Lastly, I want to talk about pharmacists and educating. We are constantly educating. No matter what setting you will end up in, whether it's hospital, retail, academia, you are always going to be educating. And it is important to know this because we're always going to be helping patients understand what their medications are doing and why are they on them, or maybe they're experiencing some side effects. What may happen with those side effects, and what should they expect, and what should they do when that happens, and such. So now you may be thinking, how do you become a pharmacist? Well, you are on track. You have began your undergrad, or you are in your undergrad, and I'm here to inform you that there's two routes that you may take. You can do a 4-year bachelor degree, or 3, just depends on how fast one might complete their bachelor's degree. So you can complete a bachelor's degree, or you can do just 2 years of prerequisites. You will not earn a bachelor's degree, and you just complete the courses that the program requires. So I personally myself took the 2-year route, and I completed the prerequisites that I needed, and I applied to pharmacy school. Then you will go to pharmacy school, which is 4 years of a doctorate program. You'll earn your degree, and then following earning your degree, you will take your licensing exam and your state law exam, and then you're a pharmacist. So it's exciting. It's quite a journey, but it is worth it in the end. So I did mention the prerequisites, and this is what I am referring to. The caveat here is that every school might differ on the prerequisites that they require. This is the list of Manchester University's prerequisites that we do require. So now you're wondering, what is the next step? Maybe you've taken all your prerequisite courses, you're getting close to actually applying to pharmacy school. Now is the time where you are going to learn about PharmCast. Some of you may already be familiar with PharmCast or have heard of it, but this is basically a centralized pharmacy school application that allows you to store your transcripts, any PCAT scores if you do have any experiences including employment, extracurricular activity, and such. In addition, your letters of recommendations will go here. So basically, it's going to be your go-to when applying to pharmacy school and trying to keep organized. And it's basically a database where multiple pharmacy schools that you decide that you want to apply to can pull all this information from, and it's all in one spot. In addition, Manchester University also requires a supplemental application, and this allows us to get to know you beyond PharmCast and kind of ask different questions that you may not have gotten on PharmCast. And finally, when all is said and done, if all the criteria is met, you will be invited for an interview based on your applications, and if we feel that Manchester would be a good fit for you. Things to consider, and these are definitely not something to look at and say like GPA will be break or make whether I'm even considered for an interview. It's definitely a compilation and everything as a whole that will make you stand out as a candidate. This includes your GPA, your completion of all your prerequisite courses on time, your extracurricular involvement, and we like to see, were you in school entirely or were you balancing work and school and some extracurricular activities? So that's something we definitely do pay attention to. Um, Interviewing skills, a lot of people do get nervous and they just don't like interviews, and they might have these like tics that they do or things that really just can't control during interviews because they're just not used to interviewing. So that's definitely something to work on prior to interviewing for pharmacy school, because the interview process, it really is the one time we get to see you face to face and get to know you, ask you questions, and really learn why are you interested in pharmacy. And then letters of recommendations are really important, and it's important to make sure that whoever you decide will write this letter of recommendation will have the best things to say about you, and it is someone you've really developed a relationship with. And then finally, preparing your transcripts that will be then sent to PharmCast. Okay, now I just want to talk about the salary of a pharmacist, because this is a common question. It really just depends on many different factors, especially location, and that can just vary by state to state. And then in addition, another factor may be years of experience or if you're specialized. On average, the range is $90,000 to $150,000. Um, One thing is that if you do decide to pursue a residency, for that year, you would be making $35,000 to $50,000. But in the end, it is worth it because it will pay off. And of course, you are now specialized. You pursued a residency and you continued your education beyond pharmacy school. Areas where pharmacists work include retail, hospital, physician offices, clinics, and many others like drug manufacturing companies such as Eli Lilly or the Poison Control Center for Help. So as you can see, sometimes there are places that like you don't think, oh, I didn't think that a pharmacist would work there, but I do see like they can have a role there. So sometimes you can look beyond just maybe CVS and find different spots that you think like, I would love to do something like this. Just a little bit about residency if you're not familiar with residency, which is completely okay because this is something that you'd complete after you've completed the pharmacy program. So residency can be 1 or 2 years, postgraduate years. If you decided I'm going to do a PGY1, this is more generalized basic training for a year that will kind of cover different areas. Whereas if you decide I want to do a PGY1 and 2, whereas in your PGY2 you will focus on infectious diseases and solely just focus on that specific field in pharmacy. The process, just kind of like how you prepare to get into pharmacy school, this process of like trying to apply for a residency is kind of similar because you're building your CV, and that includes your volunteering, research, and leadership throughout pharmacy school. And then towards your final year, when you do reach rotations, challenging yourself and doing rotations that might help you decide if you want to do a residency or not. And then, of course, just finalizing your CV, letters of recommendations, attending different meetings and exploring residency programs, and then finally interviewing and the match process, which is very exciting. So just a brief list about where pharmacists can specialize in. I know it's actually a long list, but this just goes to show that pharmacists can have an impact and focus and specialize in so many different areas. Ambulatory care is basically, you will find them in physician offices and clinics, and this is when a pharmacist will work with a patient um, with chronic conditions such as diabetes or hypertension, and they will be able to sit down and focus on this disease state with that patient. Cardiology, critical care, Pharmacists have a huge role in all of these different places. Geriatric medicine, infectious disease, medication use safety pharmacist. So maybe this pharmacist solely their job is to they work in a hospital and all the adverse effects and things that can possibly go wrong in the hospital is reported to this pharmacist along with the committee, and they sit down and they say, okay, why is this happening? What can we do to ensure that this does not happen to our patients? And that is solely what the pharmacist will do in that setting. We have palliative care, which is pain management and end of life care. So the list goes on, and there's so many different things that a pharmacist can specialize in. And lastly, I just want to talk about a day in the life of a pharmacist. Throughout all these pictures, we see that no two pharmacy jobs and no 2 days are exactly alike, and it's a little bit different for everyone. As you see all the way in the left, this gentleman is getting an immunization. Whereas in the next picture, this gentleman is asking the pharmacist questions and she's counseling him on certain medication points. And then over on the right-hand side, we have a pharmacist who is rounding with other healthcare providers. And pharmacists really do play a huge role in interprofessionalism and working with a team of other healthcare providers to figure out what is the best treatment for a patient. And in settings like this, you might have a doctor say, pharmacist, like, what do you think we should do? Do you think we should be discontinuing this medication and such? And then all the way in the right is like in a clinic, in an ambulatory care setting where someone might come in with diabetes and the pharmacist will help manage that patient's diabetes. So there's many different areas that a pharmacist can focus in, and I just wanted to be able to give you guys a brief overview, and I really do appreciate you guys listening to this whole video, and there is going to be a Q&A with myself and another fourth year pharmacy student, and we'd love to answer any questions you guys may have. If you are kind of on the fence of doing pharmacy, you don't know if pharmacy is for you, or if you are getting ready to apply for pharmacy school and you just need questions on, I'm not really sure how this works or how to get to this or anything with navigating, please come to our Q&A and we would be happy to help you guys out. Thank you so much for watching.